Bio Valley Incubation Council and Medi Valley Incubation Council, the incubator arms of Andhra Pradesh Medtech Zone, who are supporting the startups developing products in the areas of regenerative medicine, critical care devices with IoT platforms, advanced wound care domain, diagnostic and therapeutic devices. This session would certainly prove helpful because they come up with so many queries, concerns, and doubts while filing the grant application. And I thank you all for making this possible to help them, support them, file the application, and guide them across the process. Thank you so much. And Apurva, special mention of you, thanks to you for coordinating this event. And I hand over the platform to you so as to take things forward. Thank you.
Thank you, Dr. Sushila. And thank you, the team BioValley, Ankita, and the incubators who are present here. Thank you, Dr. Ambud, Suresh, and Dr. Vishu for sparing some time and share the knowledge with the incubators. We would encourage even one-on-one if somebody wants their proposal to be, studied in detail and want to know more about BIG, please reach out to BioValley team and we can connect over in the next few days. So welcome everyone and good morning to all of you. I come from IKB Knowledge Park, which is a not-for-profit private science park and incubator headquartered at Hyderabad. So far, 1,230 plus innovators have been supported across India through various initiatives under IKP and through BIG grant itself. We have 165 big awardee from 2010 onwards till now. BIG, it's a very now common word we use BIG, but it stands for Biotechnology Ignition Grant, which is an idea to POC grant up to 50 lakh rupees. And it has been given to the grantees for 18 months duration. The areas supported under for BIG are drugs and drug delivery, medical device, industrial biotechnology, secondary agriculture, diagnostics, and any digital AIMS solution overlapping all these areas will also be eligible. I am sure that AMTZ has this, they will apply for the medical device and pharma solutions. Any person who's graduate or if any startup who's more less than 5 years old would be eligible to apply for BIG. The selection process involves call for application twice in the year from 1st January to 15th of February. The call lasts up to 45 days mostly. And then the second call is in July, which is followed by the selection process, which involves online review through the experts, followed by face-to-face presentation, which is known as TEP. Then the cutoff scoring, which has been decided by the funding agency, and selection of the grantees. Main evaluation criteria for the grant throughout, even including an online and for the overall evaluation is unmet need, value proposition, technical viability of the proposal, team strength, and business perspective. These all pointers hold a particular place for the scoring, but apart from all these points, commercialization potential of the product or technology, IP, and clarity on the regulatory aspects involved in the proposals are really another important points which applicant should take into consideration. BIG being a really comprehensive and competitive grant, it involves 10 important components, which I would request Dr. Vishu to please take us through.
So when you are starting the application, the first thing that comes is the title. So I would request you to give a sensible title where that is the first point of your contact with the reviewer. And if reviewer understands what he is getting into, he will be a little comfortable and there may be a benefit of doubt in case of something. But if it is very confusing or very boring, so we lose something. So just make a 6 to 7 word title. And the next one is the introduction. And be it a medical device, be it agriculture, be it any standard things, the reviewers are very familiar with the basic problems. So don't spend time on very general things, but important data points. Let's say if there is a 1,20,000 crores loss is there. So you can mention that with a reference to a particular, be it Ministry of Agriculture, a reliable data source can be cited there. And so that you are quoting most important thing with a data. So, you don't have to fill 500 words because there is a 500 word limit is there. Just give the sufficient and always use the last 2-3 lines to connect to the next one. So in case of introduction, after you give the broad points and you connect with your project. So whatever is coming, the next immediate heading, that should be connected from the previous one. And don't try to fill because there is a word limit. So just give what you feel is important. And of course, you have to highlight, you are very familiar why your product or the project or the platform is excellent, but you have to define in a very simple 1 or 2 line when they're asking about the value proposition. And then you can give the details supporting how the end user or the customer is benefited by using your product. I think, in Suresh will be explaining more about from his point of view, so that you can pick how he is able to provide the value proposition to the physiotherapist or the patients, people like me. And the next one is the differentiator. And many a times people claim the first sentence is, we are the first time people, we are the unique, there is no other product like this. And the reviewers have seen so many projects like this, and I would request you to look for the nearest competitor and please put a feature benefit analysis table citing all the things. And it's good to mention about your competition. Many a times people say that people feel that by giving the competition details, you are being undermined. No. So there is a scope in most places for the projects to run together, to companies to coexist, because the market is quite huge. And the next one is team. Please pay attention. Sometimes if you are a single person, it is good to provide whom you would be approaching. If you have not already taken their consent, it's okay. You can mention in the in your presentation that you are yet to approach, but these are the persons in mind. But coming to the scientific advisors and business experts and all the advisors, you have to take a letter of consent. And I'm sure, as most of your companies, for a company to have a scientific advisor and business experts in writing will be very helpful. So you can have your understandings with them, whether they will spend half an hour for a week or 1 hour for a month. These things are optional, and many advisors will be very happy that, you go with very specifics. This is what is required, because some of these experts may be reviewing your projects in those panels, and if they are not informed and if you use their names, it will not be good. So you might be knowing many of them because this is such a small ecosystem. But my advice will be to take through email a consent that you are keeping them as advisor or an expert to support you. And coming to the competitive landscape, again, extension of the differentiator. So what are your plus points? And maybe many a times people try to say everything is special. That is not true. Be honest. Wherever you are not special or not scoring, just mention it. It's okay. But specify how you are going to be having edge over the others. And price is, especially in the healthcare, price is not the only thing. And also, after going to the hospital recently, I must tell, patient comfort is not the only thing for the products. I think hospital income and how your product or technology fits into the entire value chain or the care delivery is much more important. I see, because many of you are passionate doctors and scientists, and you always think that patient care, better patient. That is good. That is one of the angle, but the other angles are equally important when you are looking at the commercial viability. And objectives and milestones. Many a times people don't pay attention to alternative. There will be a particular 1 or 2 liner asked, what is the alternative? And many people think that we have cross verified with our experts, this will work. And that is not the purpose of asking what is the alternative. In case if it doesn't work, be it like, let's say that buffer what you are ordering from some country doesn't come. So do you have another mechanism to do that experiment? Or if that protein is not binding, enzyme is not binding to the column as expected, you have something. And what you will be achieving that 6 months should be very clear. So for example, if you look at the second objective, many a times it will be very broad, like characterization of activity and stability of enzyme. And when it comes, let's say you win the grant, and when you are asking for second tranche of money, then I will say that it is not to my expectation. I want this to be much more active and more stable. Then you are in trouble. Instead, if you say that I will achieve a specificity of 10,000 units per milligram, and I will have a, let's say, 180 days of stability at room temperature through accelerated studies, and I will provide this, so and so lab certification, then I can never question your results and will be taken to the next level. So these objectives and milestones, they should be very clear. They should be helping you and helping the funding agency to release the funds. If there is any ambiguity, it is problem for both the sides. So I think, these are the broad topics which I want you to, pay special attention. And most importantly, for budget and also the first milestone I missed, and most of the people write first milestone as buying equipment, buying consumables, that is not an objective or a milestone. That is a part of the process. Once you receive money, you will buy those things, but that is not a core objective. That is one of the activity. So it can be like a sub activity. So don't be appearing silly when they are reading. So please pay attention and make sure that they enjoy reading your proposal. Then you will have some advantage. Coming to the budget, this is actually literally nuts and bolts are included here, and it should be like that, including cost. So what is that they are buying, how many units they are buying, what is the specification, what is the cost, and what is the justification. And these kind of proposals, the reviewers will be very happy, because many a times they will say enzymes, consumables 12 lakhs, salaries 15 lakhs. So that means you have not worked out sufficiently, or you might have felt it is not so important to give it there. But if you are a company, for an enterprise, these details are very much important, and from where you will be procuring, how much time it will take is also very important. So I would request you to have a look at this and then update accordingly. So I think I covered most of the points. All the innovation grants, not just BIZ. When you are going into pitching, final pitching, or online review is happening, they want to see what is the novelty. Though we claim that we are the first one, they want to see it. So for example, here is a student from remote place in Karnataka. So they were able to find that one fraction of the fruit has a fruit fly attracting ability. So they have shown it in the field. On the left side, you can see that they just poured on a filter paper, and when they put it in the field, but they don't have a formulation. So be it any drugs or a pesticide or a long. So there are some people like IKP Prime. IKP Prime is the IKP Technology Transfer Office. Dr. Bandana, Dr. Hema, Manish, Vittal, Harshada. So we have a strong team of IP professionals who will help you. And Apurva will be very happy to connect if you are stuck somewhere and you are unable to convert your claims into so-called possible IP, because this is one of the major deciding factor for any innovation grant, not just for BIZ. So that's why I'm going to spend a little more time. So here you can just say that I have an idea, I have done some preliminary work, and I will get IP patent. So usually they will write, we have already filed a provisional. But if you can present, so as you can see on the right side of the image, this will be my copyright, this will be my industrial design, this will be my formulation patent, this will be my design patent. Then the reviewers will get your product profile, not only getting a product profile, how this is unique. So you will actually score multiple things in a single thing. So with this, I would like to say, pay attention to all the parts, but wherever possible, convert your normal sentences into visuals, because you have to upload a PPT. That really helps in reviewers having a better understanding and ultimately scoring better. So with this, I will stay back and just wanted to present some of the BIG awardees like Dozy and Fizi. They are going to talk next, the Startoon Labs. So when they started, they didn't start as what they are today. They started as a sleep monitoring device. So very simple at home. If you are away from your parents, how your parents are sleeping, can you monitor? Can you see how disturbed they are, or whether there will be some kind of monitoring you can do without even disturbing anybody. In case of any issue, you can call them and ask them to go to a doctor. That's how the Dozy was started in the BIG. But during COVID time, they were able to establish and make the step-down ICUs, basically monitor all vital parameters, again, everything without contact. And when it was required for the SpO2 and temperature, the other things required during COVID time, of course, there was an extra sensor that was put in. But they were able to create a temporary COVID ward in Hyderabad. Dr. Ambuj was the one actually who introduced them. And they have shown it in half an hour, and next day they were able to come from Bangalore and fix a 100-bed hospital. So that is the kind of impact you can create. I will not get into these details, but think about a problem and make your solution stronger, get your things in place. I am sure you will find a perfect use case. Thank you very much.
Request Mr. Suresh Sursurla, CEO of the Startoon Labs, to share your experience with the incubatees of BioValley and MediValley.
Sure.
Thank you.
Very good morning, all. Very honored to be here again with, in the presentation by IKP. So I'm Suresh, and I'm one of the co-founders of a medical device startup called as Startoon Labs Private Limited, based out of Hyderabad. So me and my wife, Maitri Kondapi, we founded this in 2017 November. A quick introduction about myself. I'm an engineer, not a doctor, or with any biotechnology degree. I'm an electronics engineer. I did my engineering in 2005 in VTU in electronics, and then I also worked at various companies. I also studied at IIT Madras. I did my master's there in digital signal processing, systems design, and biomedical electronics. And then I also pursued executive program in business management from Indian Institute of Management, Calcutta. So overall, I have around 18 years of experience now, with 14 years outside my own company and 4 years in my own company. So that's a quick background. I have 9 international publications, 4 patents, author of a book. I'm honorary professor in a medical college in Chennai, and I'm also a member of Institution of Engineers of India, which is a noted body under the Royal Charter 1935 for engineers. That's a very quick background about myself. So coming to the company and the work that we do. So we have developed a product called as Fizi, which I have in front of me. It's a very novel portable device for physiotherapy and rehabilitation sector of healthcare. So, I think a lot of points were covered by Dr. Visu, in his presentation as to what should be there in the BIG. Let me tell the practical aspects of it. Dr. Visu has focused on all the requirements. So I'll share my journey and how we got it and what kind of assistance we got from IKP to ensure that we get the BIG grant in the first attempt itself. I also heard later on, initially I did not know, but later on I heard that people have been applying for BIG for 3 times, 4 times in a row, and maybe the technology is also becoming obsolete by then. But hats off to the persistence of such entrepreneurs. But I was fortunate to get great assistance from IKP, Knowledge Park, and Visu, and the entire team, Dr. Ambuj. So it was great. I would love to share my experiences with getting the BIG and also with IKP. We have a long journey together already. So Fizi, one important aspect. I don't want to talk much about my product because it's not a marketing thing I want to do. Rather, I want to focus on important aspects for all these young entrepreneurs. Young, I mean, not in the age, but from the companies who are passionate to start their companies and get some good funding from the government. So one important aspect for all the entrepreneurs, is good market research should be done. you may please keep a note when I talk, because so many practical aspects I would love to share, which might add value in your own, application. So good market research, please. Please go to the hospitals. If you're on medical devices, we are into medical devices. So in our case, we went to a lot of hospitals and met a lot of doctors. And we gave some time, almost 4 to 5 months of time. We gave to understand where is the gap, real gap. See, entrepreneurship should not be like you want to become an entrepreneur, you're fed up with a corporate job, something like that. Entrepreneurship should, as this is all my personal views. Okay, so entrepreneurship is something where you really, as an engineer or as a scientist, you try to solve a real problem and address some gap in that sector. I think then it makes some sense. Otherwise, being an entrepreneur, getting some grants, all this is, I don't consider them as very, very important. So, and you can only understand the value of your product, as Dr. Visu also told in his presentation. The value, the product should add some value. And, so nicely he talked about Dozy. They bring in a lot of value proposition, and and they're good friends of mine also. So they have brought good value to the healthcare ecosystem in COVID, with their innovation. So value is very, very important. As an entrepreneur, you should get some real important solution or a technology, or something which adds good value in healthcare. Okay. So, and that is only possible. See, as engineers, I will tell you, that was also my mindset long back. As engineers, we feel our idea is the best, or we are the greatest people on the planet, or something like that. Because we love the idea. We have respect for that idea, and we feel it's very, very valuable. But let me tell you, please, like it's only from the market that we can get a good idea. Okay, so we may want to build something. We may think it's a problem, but maybe that is not the problem. Okay, because the problem can only come from the market. Hence, I am stressing once again, please do a really, really good market research. Market research means you go to the people who you feel will be your future customers and ask them, or get the idea from them. You observe them and get an idea, and then share the idea saying, will this add value? That's how we did. We visited a lot of hospitals. Finally, we landed in physiotherapy and rehab sector, where we spoke to them and we said, hey, see, if we build something which can bring in this quantification in your field of healthcare, will it add value? Literally everybody said yes. So that's how. And then, it's a long process. It's not that somebody gives you an idea and you build it. It is refined with discussions, it's refined with prototypes, and then it comes in the form of a product. So we have done almost 4 iterations before we brought it into the market right now. So it's a long journey, but it should start from there. And also in your BIG presentation or application, please ensure you put the statistics as to how many prospective customers you met, what was their basic feedback, how did they like it, how many people felt it was very useful, how many people are already ready to pre-book, or which may be very difficult in a country like India, but it's okay, because they want to see the product. Even then you have to pursue them to buy. So it's a different thing altogether, which I don't want to come here right now, but get that idea, get that pulse. Are you ready to buy? Are you ready to put 1 rupee on this product? So get that and put the statistics in your BIG presentation. I think it will add great value, because that itself tells to the jury that yes, this product is needed, because the prospective customers, even without having a product, are telling, we would like to have it. This one point I wanted to make sure. So please keep these statistics in your presentation. Second most important aspect, which I felt was very important even in our journey, is the team. So if you are an agricultural technology company, ensure the core members or the founders have real good knowledge, of agri-tech, please. What I want to tell you is, suppose you're into the pharmacology, or into drug discovery or development. Ensure the founders have good knowledge, or the partners or advisors have good knowledge on the subject, on the core subject of your company. And remaining things we can always outsource or partner with. Okay, so team is very one important aspect which BIG jury looks very much into. So please ensure your team is good. So what I want to tell in short is, if you are a medical technology company, ensure you have engineers for sure. If you are a biotechnology company, ensure the founders, the core people are from biotech, in that way. If you're agricultural technology, whatever, It cannot be like you have to depend on somebody else for your product. I think that's a big problem. If that guy leaves, then we are gone. So that brings, the core team is strong, and the company is built on the core team members. I think that's where it brings a lot of value and trust. Okay. However, I think which is also important is the business aspect. As engineers and scientists, we feel the tech is good and the IP is there, etc. But one thing which even we lack, I think now after 4 years, I understand. But it's okay. There's always a learning, which I want to tell you so that you don't lack that. Have some business advisory on your team. Some experienced person from that field. That adds immense value. So the core technology will be done by the core team. However, it doesn't mean that your team lacks business skills, because a scientist cannot be a businessman. There are very few people like that, or a hardcore engineer cannot be a businessman. So have some real person who has done business, maybe give some advisory stake in the beginning, have them on board, and show that as your strength when you pitch to the jury. Okay, that's very, very important. Just don't bring any random business person who's selling tomatoes or something. Have somebody who has good experience in that field. That adds good value. So I think team and advisories I wanted to cover. IP is also very important thing which Dr. Visu covered. Maybe if you have a provisional patent filed, I think that adds great value. At least a provisional patent, okay, and a trademark, whatever, because it also helps. It gives you strength when you pitch. You say, hey, I am novel. My product is definitely novel. It has some novelty, though there are other products, but definitely there are some gaps in existing products which my product is, solving. So in that way, you can claim your IP. One important aspect is, though BIG says it's a idea to POC, I think you will have some weightage when you already have some proof of concept. So in medical device, you can have a small tabletop model, with off-the-shelf devices. It may cost you 1,000, 2,000, 5,000 rupees, but at least you have a feel. Okay, it can work. Okay, but I don't know how much it is possible in biotechnology and in pharmacology with drug discovery and all. Maybe there some equations are important or whatever. I am not a knowledgeable person to comment on that. But at least what I mean to say is, have something concrete, at least a base platform, before you pitch, rather than talking about an idea in the air. So I think that has some value which will help you in gaining the trust of the BIG jury. And I also spoke about business model. You should have an advisory who can say, if I build this product, though it will be put in the market maybe 3, 4, or 5 years down the line. It takes a lot of time to build medical devices with regulatory and all. But at least you should know either you are selling it or you're leasing it, or different models are there where you think this is the way you should get revenues. Have that in the slide, some tentative model, and then BIG jury and IKP expert mentors will keep questioning, and then the model gets refined. Also, for us, it happened. In the beginning itself with Dr. Visu and Dr. Ranajit, we were talking, and Dr. Ambuj, definitely from day zero they were there with us. So it helped us a lot in fine tuning a lot of business models. So please put all these aspects very, very clearly in your presentation, because this brings in a lot of credibility and seriousness of your work. Okay. And one thing which I actually learned from IKP, which I should also share here, have some, like, see, mine is an engineering company. Have some partner, the clinical partner. Have a hospital tied up with you. And a quick MOU, one page. So this was the advice given to me by Dr. Visu in the initial days, which helped us actually, because it helps us understand once the POC is ready, how do you validate it quickly? In an informal manner also it helps. But it's always good to have a hospital, or in our case it was a physiotherapy center or a physiotherapy department with whom we had an MOU saying, hey, once I have a POC, maybe in 8 months or 10 months, I would love to have your support to validate it on 50 patients. It gives it, before you complete your BIG grant, it gives you a lot of confidence also. It's not for showing off, it's to ensure that you are on the right path. So that helps us a lot. And yeah, and coming to the clarity of funds, I think Dr. Visu has told on this, but let me tell you my learning from this. Clarity of allocation of funds is really, really important, because a lot of my friends who got BIG grants, a lot of them said, hey, the funds are not sufficient. I allocated this much. What are you doing? I did this. So what happened was, you plan something in the air and nothing works out. So it's a loss of money of the government, which should not be done. You should ensure every rupee is used well and for good reasons to grow the company. And that's what honestly, and as Dr. Visu and Dr. Ambuj know me very well, we have used every rupee in a very, very, very honest manner, very useful manner. And I'm so happy to say when I approached IKP, I means, we as a company, me, my three, we were going to IKP, we demonstrated a very, very crude product. By the time we are done with the BIG, we literally had one version ahead of this. It was great progress that we made just in 18 months with the money that we got from BIG. And it's we made 3 iterations and it worked so well. And one small fine tweaking and this project came out. So I'm very happy and proud to say that it is possible to bring your POC to literally a market ready product with BIG. That is the value I think BIG grant brings to the startup ecosystem, and I respect that and I value that a lot. So this has to be communicated to you because many people say BIG is just so and so, just so and so. It is not just. Please, we need to have respect for that money and it has to be used well. So have a very, very concrete plan of how much will go into salary, how much will go into POC, how much might go into clinical research, how much may go into patent filing. Talk to, there's so many service providers nowadays. Get a quotation. That helps a lot. Get a quotation and put those numbers. And I think that is also a part of BIG that you have to share some quotations or whatever to show them. Anyways, it's not about showing, as I want to tell you, it's not about showing somebody. It's about your entrepreneurship and your journey at the end of the day. So if you talk to different stakeholders, get quotations, you yourself will understand how much of money will go into it. Please put that in a very nice manner and present it to BIG. And once you back your funding requirements with quotations, I'm sure no jury will ask you further questions. Hey, how did you, budget for that? That's very, very important because that also gives the picture to the jury that how clear the innovators are. How clear the innovators are for the next 18 months of journey that BIG is helping them to, to walk. So this is what is seen, and this shows your clarity. It shows your thought process of the entrepreneurs. So all these 6, 7 points that I shared with you requires good amount of work even before it is penned and written in the BIG application form. But I'm telling you, BIG application form itself talks 50% about the entrepreneur. That's what we are seeing. Because the patience that is required to fill a BIG form, I know of people who have dropped from filling the BIG form, saying that, it is too much. Hey, you don't have patience to fill a BIG form, but you want money, huh? I'm sorry, so it is not respected in that way. Entrepreneurs should have the patience to fill the BIG with utmost honesty and with utmost clarity. And clarity will only come when you do all this homework that I have been talking about in the last 20 minutes. And with this clarity, when you talk, I'm sure the jury is wise enough and very clear and experienced to understand how clear entrepreneur is. I think these are my quick, very, very important inputs before you fill the BIG. But I'm sure if you do this, because I have walked the path and I've seen so many people walking this path, and I've also been, with Dr. Visu's. He's humble enough to always call me on BIG, presentations, and I have spoken to a lot of entrepreneurs, and they have listened, and many people also come back to me saying, hey, it really helped us a lot. And that's the main intent, because we have nothing to gain here, but rather to help the ecosystem in the country build, in this way. So that's all, sir. Visu sir and Ambu sir and Apurva from my side and Dr. Sushila. I'm open to any questions, please. Thank you very much for this opportunity.
Thank you, Mr. Suresh. Your suggestions were quite categorical, and I hope it would really help our incubatees or our startups to understand the focus pointers and the attitude towards filling the application form.
I think attitude is really, really important, because with this attitude, you can walk the entire 18 months.
This is something we could really learn to.
BIG team looks at attitude, let me tell you. They just don't look at a form, they look at the attitude of the entrepreneurs. I have seen that and I've experienced it. So, these words, I'm sure it will help our people. Yeah.
Yes. So hopeful all our incubatees are taking the note of it, and for sure would be able to inculcate the same in their applications by taking BIG as their grant mentor. And Dr. Vishu, thank you so much. You're really not well, but you really could join us in this session to give beautiful objective-wise suggestions to all our partners. Thank you so much. And now I give over the platform to Dr. Ambuj Trivedi, a neurosurgeon by profession, and he is the Senior Vice President at IKP Knowledge Park. He is currently leading the MedTech vertical at IKP Knowledge Park, Hyderabad. Over to you, Dr. Ambuj.
Thank you so
please
much.
share your views and suggestions and insights that may really prove useful for all our partners to move and walk while filing the application and through the entire process of the grant. Thank you, and over to you, Dr. Ambuj.
Thank you so much. Thank you so much for having me here. And Sushila, before we just you took one Ved out of my ancestors' efforts. I'm just Chaturvedi here. so there were 4 Veds, not 3. So.
Dr. Ambuj Chaturvedi. Yeah.
Yeah.
Thank you. Yeah. Good.
So yeah, so a warm hello from Genome Valley to Medi Valley, Bio Valley. My name is Dr. Ambuj Chaturvedi. I'm a Senior Vice President with IKP. Well, I'm a surgeon. I'm a neurosurgeon by training, who then decided to do his MBA and moved on to the management side of things. I moved into the corporate world. So a decade as a clinician, the next decade as a corporate professional, working with companies like Johnson & Johnson and then Medtronic. Commercial roles, sales, marketing strategy, and then moved into technology roles. Was the last corporate profile I had was head of R&D for emerging markets for Medtronic. So a surgeon who's now working with 230 engineers, and that's what the kind of evolution has been. Post which I decided to, and at that time I was an industry reviewer for the BIRAC. And so I've been on the review panels multiple times. And the energy I saw in that entire panel, and especially with the innovators, made me actually take a decision to leave my corporate profile and then move on to IKP, where I could, interact with entrepreneurs on a day-to-day basis like I'm doing right now. It's been 2.5 years, interesting journey. We do run a slew of initiatives. Vishu has talked about it, whether it is incubation, acceleration. We have a lot of infrastructure. We have 9 centers across India. And at the same time, we also look at supporting. So we have finance vehicles, funding vehicles, multiple funding vehicles within IKP. We have tech transfer offices. We are into policy as well. And now we are moving into One Health. So pretty much a big ocean. I'm just dropping that ocean. What I'm going to talk about today, and it is 12:14. So maybe I'll 12:15. So I'll probably talk about 5 to 7 minutes, kind of give you a brief preview. See, a lot of the basic aspects, or even the ground rules for how you make a pitch or how you make a presentation have already been shared by Vishu and Suresh. What I will do is I'll give you a kind of a candid feedback as a reviewer. These are preferably not noted. I know the session is being recorded. The point is, these are all informal suggestions. It's the way a reviewer thinks when you are actually presenting out there. So, so when I talk to entrepreneurs and I say, "Aapko presentation banani hai," the first thing I tell them is, how do you choose a book? How do you choose a book? You're at the airport, you have a bookstore, you have to make a choice. How do you choose a book? You basically look at the book, you look at the author, you look at the brand of the author. That's probably the first thing that goes in your mind. Okay. Once you open up, you look at the foreword, you look at the preface, you look at the contents, the contents and all that are presented out there. And once you've actually seen that, then you start looking at the overall package. Is it relevant for me? Right? And is it going to add value? And you take that entire decision in probably a minute or 2, right? Because that's about the time you have at the airport, right? That's exactly how a pitch for an entrepreneur goes. The reviewer has only 8 minutes to judge you. So it's an 8-minute presentation and a 12-minute Q&A. That's about 20 minutes, but it's just 8 minutes. So your book only has 8 minutes to present itself as the best alternative. And so there are 2 keys. The first one is the value you bring to the table. And the second piece is how you present it. How do you pitch it? So let's talk about value. A lot of the concept of how to build a problem statement was actually shared by Suresh earlier. But just to add on to that, there's a concept called immersion. I'm hoping that a lot of you are already aware of it. If you're not, you might Google it out. Clinical immersion, at least for healthcare solutions. Clinical immersion becomes a sine qua non. Clinical immersion A lot of people think, okay, clinical immersion is about going to a hospital, looking at what a doctor or a nurse or a healthcare professional is up to, and then kind of take notes. No. The ideal clinical immersion happens when you are able to get so much into the shoes of your prospective customer that you start feeling the pain at an emotional level. So if you are watching a surgeon operate and you realize that every time he sutures, the suture breaks, imagine the angst of a surgeon, because you're actually doing an anastomosis and the suture breaks. So every time the suture breaks, the mucosal line, submucosal line on which the suture is actually anchored kind of gives way, and you're basically losing tissue. Now, if you are able to gauge the pain of that surgeon at that time, that's empathy. That is the true meaning of clinical immersion. And when you start doing that, then you start coming into, okay, getting a better suture is not about getting a better brand. It is about losing less tissue. Now you started to convert the entire problem statement into exactly what the surgeon would want to see. And then giving you an example, because I'm a surgeon myself, so the same applies to a nurse. When a nurse is screening patients out there in the rural areas and the machine just conks off, and you realize, why is it conking off? Well, it's probably because it's battery operated. The battery doesn't have sufficient shelf life, and so therefore you say, okay, can I solve this problem? And so there are startups which have actually circumvented the entire concept of even depending on battery sources and actually going into hand cranked solutions, right? So there are all these different nuances that come in problem statement. The key is clinical immersion. Once you've done that and you start looking at the solution, that is where, again, two key points that you need to watch out. The first one is VOC, so voice of customer, which is how well are you talking to, and Suresh pointed it out very well, which is that, it's not just enough for a customer or prospective customer to tell you, yes, this is good. The ultimate test is, will this customer pay? Will you pay? Will you pay for this? And so the moment you start looking at paying customers, that's when you realize customers who have true value for it. So the entire concept of business is saying, I have a problem, I got a solution, the solution is good, n is equal to 1. By induction, can it be relevant for n is equal to n? Because when it's just relevant for one customer, that's not business. When it's relevant for a segment, then it's business. And when it's relevant for the entire market, it's a unicorn, right? So you ultimately prove it for one, but then you start looking at the larger market. And you say, if there are two customers, one of them who agrees there is value and the other who doesn't, what is the difference between these two customers? And that gives you the customer segment, the segmentation that you're getting into. I mean, this is all marketing 101. You might want to read about this. You might want to go to, you can put big picture marketing, and you can go through it and you realize how you basically build an entire market size. Coming to market size, one of the key things that is watched for in the pitch is how well have you segmented the market, have done the landscaping, segmented the market, and then start looking at the unit economics. We're saying, if I sell this, if one unit of this is sold, what percentage of it goes in the cost, what percentage goes in the distribution, what percentage goes into the service partners, and so therefore what is the profit, right? Those are aspects that the reviewers are looking for in those 8 minutes. They're not looking for, sir, TB has a big burden, there are X million patients. Everyone knows that. So I don't need general information. I need very specific. So if it is 8 minutes, the max you can do is put in 5 to 6 key points, and those points need to be highlighted onto your pitch deck in such a form that the first line of sight should be on those highlighting points, and that's it. You crack not on verbose 20 slide decks. You crack on just 5 to 6 specific highlighting points. Now, this is assuming that you've already created a value. Okay. Now, competitor profile. Again, a lot of stuff done on competitor profiling. So people typically what they do is they take up a table, they put 3 or 4 competitors, and then they ensure that whatever features they have, the others don't. So they choose those features which they have and which others don't, which is not the way to look at competitor profiling. Competitor profiling, in a sense, and if you want to make it clear to the reviewer in 45 seconds, you just make a x-axis and y-axis. You make a 2x2 quadrant. You choose only 2 of the key attributes which are relevant for that market. So if it's a rural market, probably it is price versus performance. If it is a tier 1 market, it's not price. It is brand versus performance, or it is luxury versus performance, right? So depending on what market you are into, you choose those 2 key attributes which help a customer or help the market in differentiating. And then there you start mapping all your, so if it is price versus performance, you say low price, low performance, high price, high performance, low price, high performance, high price, low performance. And you start matching all of them around, and then you find, where you are. And that is what positioning is all about. You put all those verbose data, reviewers cannot assimilate all of that in the 45 seconds that you have. You just put in one pictorial and you're through. So that's one key insight on competitor profiling. Ask deployment. I think Suresh again was very clear. When you're asking for money, it doesn't have to round off to 50 lakh. It can be less. It could be more. But at the end of the day, you need to be very clear and specific with where this money is going. So you can't just say 15 lakh manpower. You'll say 15 lakh because I'm going to have these 10 engineers. Of these 3 would cost in this range, 4 would cost in this range, and the rest 3 would do. And so therefore it comes to 15 lakh. Right? So that's how you. Finally, on the team, I think, again, a health company without a healthcare professional, you're already out. You're not even going to make it probably through the online reviews. Forget the in-person reviews. And so therefore, it's very important for you to have a team. Typically, if you have a founder, that's great. If you have co-founders, even greater, because then you have a different perspective coming in. And it also tells the reviewers that you are open to suggestions and advice. So as Suresh said, if you want something core within your team, you can't expect to outsource it. If it's core, it has to be in your team. And when you present out there, it has to be a joint phase. Right? With this, I finally come to some very 4 points. And these are again very informal points. The final 4 wrap-up points. First, make your pitch after you've done the value and the piece, right? And now we are talking of pitching. Make your pitch. Practice, 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 practice. Keep on practicing. It should be so clear. The pitch should be so. It should be so part of your being. Raat ko 2 baje bhi uthaya na, you should be able to rattle it off. You should be able to rattle off a 90-second pitch at 2 a.m. in the night. This is an entrance examination, mind you, right? So if you have to crack it, then this is the way to crack it, right? Practice, practice, practice. Talk to your colleagues, talk to the other pieces, network with mentors, make your presentations to mentors. And I'm sure BioValley, MediValley will have lots of them of course. And now that you've connected with Apurva from IKP, you'll have chances. Go ahead, present. What does it take? 8 minutes. 8-minute presentation, make 2 points, if even 2 feedback points make sense to you. You are now less by 2 mistakes that you could make in the final pitch. So practice, network with other entrepreneurs also, not on the pitching part. There are certain things that you need to keep with yourself, right? But there could be synergistic values developing between you two. And this is very relevant in digital health, where IKP is right now putting in a lot of effort, resources, and money, of course, and time, of course. And which is that, you have individual components, but can you combine forces? Can you combine forces with, and so therefore you present an integrated solution that has even greater value. So network, mentors, fellow entrepreneurs, whoever you think is relevant for your team. Don't hesitate to just go out in a meeting and introduce yourself and start talking about it. Keep your pitch ready with you. You never know where you'll click. Okay. The third piece, in the presentation, once you're in the presentation, spot your champion. There will be 10 reviewers, there will be 12 reviewers, but after the 8-minute pitch, there will be a couple of reviewers, typically the chair and then one reviewer, who will be asking a little too many questions. But these are the reviewers. If you are able to convince them, you should be actually able to convince the entire panel. Right? And this typically happens, and this doesn't happen by accident. It happens by design, because if it's a healthcare pitch, if it's a clinician pitch, I'll probably question a lot. If it's a biotech pitch, my biotech counterpart in the review panel will question a lot, and you spot that very early. So you keep on iterating on your pitch in those 12 minutes as much as possible, and that also requires practice, right? So to keep that in mind. And final thing, if you don't make it, because a lot of you will not make it in the first attempt, and it's not because you don't have it in you, it's just pure luck. Sometimes it happens, 52.8, 52.6, but you have to close the limit at, and so you can only choose 10, because that's the BIRAC budget, right? And someone loses out. 52.8 and 52.6 में सिर्फ 0.2 का फर्क है. It's just a 0.2 difference. But shall we? That's life, right? If that happens, you again go in with more concerted efforts and get in. No bad mouthing. And I've seen a lot of, not a lot, but there are a few who, if they don't make it once or twice, they've probably written stinkers out here. Abhi, nowadays it's the world of the social media, so they go out on the social media and look, it's not going to help you. I'm not saying it affects any one of us. The point is, it won't help you. So you go out there, you actually create a brand, which, because remember, once you are in the entrepreneur world, you create a brand for yourself over the next 10 to 15 years. People know you for that. Mind you, by BIG is not the last grant you're going to have. After this 50 lakh grant, once you have a prototype and an MVP in hand, there is a licensing piece, there's a regulatory piece that you have to get further grants. Then there's a commercializing piece for which you have another need to have other grants or funding. And then there is pre-series A, series A, B, C. All the investors in the ecosystem talk to each other. Every week I get at least 2 to 3 calls coming and, Doc, what do you think about this startup? Right? Because we're all connected. If you create a negative brand with one, you actually, it is a staccato effect. And if people use social media, I don't know, that's an incalculable harm according to me. It doesn't make sense. I mean, still, if you want to go ahead with it, you can do that. It's a free world. It won't help your purpose as an entrepreneur. Yeah. And so with this slightly cautionary note, I hand it over back. It's 12:28. I think I've stretched a couple of times. So Sushila, over to you. Over to Team Bio Valley.
Thank you, Dr. Ambut Chaturvedi. Thank you so much. You have covered how to build a pitch, and this would be very informative. This is very informative, and hope all our partners would be able to understand and incorporate. And now there are few questions from the forum. Can I move it on and give it on to the forum so that they can address their questions and get their queries resolved from the IKP team? Would that be okay? As it being the QA round. Apurva, can I take it for a Q&A session?
Yes, please, ma'am. Go ahead.
Thank you. The partners of Medi Valley and Bio Valley, plus the others join in the webinar. The forum is open for your questions. You are with the IKP team, and this webinar is just not the end here. We can always reach out to them for any help, mentorship support, for any requirement of any insights or the way forward for the grant. But for this session, to take it forward, I request if any one of you have any questions, please take few seconds to introduce yourself and quickly move on to the question so that the speakers would have ample time to address your query. And I think there are around 10 to 15 queries. Ankita, can you just facilitate? If it is from the conference hall, Ankita, can you please facilitate?
Yes, ma'am.
Yes, Ankita, please go ahead. Let our partners introduce themselves in few seconds and the query be asked for.
Sure. Anybody, any queries? So, ma'am, we received a few of the queries online. Can we just?
Yes, please. Let us go ahead. You can take the lead and
Yes,
let the speakers know the queries so that they can answer.
Yes, ma'am. Just a minute. I shall open it.
Hello. Can I ask? Meanwhile, can I ask one question?
Please go ahead.
I am Dr. Subramaniam Manta. I am a vaccine bioprocess development scientist. And recently, I worked in major Indian biotech companies in vaccine process development. Right now, I'm just acting as a consultant, but I have some few ideas where I thought I could develop a process or some related to the vaccine industry. Like, for example, recently after this COVID vaccine, I started reading and I put in some ideas. So how can I go about with these ideas? How can I start? How should I collaborate with process development and also some which could aid in the in the process of developing the vaccine process. So I do not have any funding. I'm on my own, and how should I go about it? I know it's not related to the grant, but before even I could pitch in for a grant, how can I need some support. I need to join, or I should collaborate with somebody else. So how can I go about it?
Okay, so there are different types of grants are there. So this is the idea to POC grant, and if it is a prototype kind of thing, then Nidhi Prayas, which gives 10 lakh rupees. But if you are saying that you want support before grant, it is usually through the incubation. So the incubators usually provide, and sometimes incubators also have a seed fund which they would support.
Okay.
And if the funding is not the major requirement.
Where are you based out of, Dr. Subramaniam?
I am in Hyderabad, sir.
You're in Hyderabad. You can connect to any of the incubators out here. Talk to them. As I said, network first. The first step for you would be to actually concretize which problem statement you want to solve. Keep a small concept note on what kind of solution you have. Once you've got that, you will then need to, once you're connected with the incubators typically will help you in terms of cleaning your idea, so to say, sanitizing your idea. That's one thing, your solution. Second piece will be, you will need a team. So typically what we've seen is a lot of the solutions that come in from hardcore researchers, and researchers are great when they're solving problems. But when you're building a business, Dr. Subramaniam, you need more people.
I know that's where I'm waiting, like I do not have the resources to, human resources is no issue, but the problem is financing.
Don't wait. Just visit the nearest incubator you have, dive into the network full-fledged, and you will find your way. You will swim through it.
Okay. Thank you, sir.
Ankita, I have provided one question online. Can I ask right now?
Please go ahead, sir.
Yeah. Sir, we got Startup India seed fund recently. Means in the month of May, we received a fund of 20 lakh. It is not a grant, it is a debt in the form of debt. Are we eligible again for this kind of thing?
Yes. So anybody received any other grant or an investment or a loan, they are perfectly eligible. Only thing is, if you have mentioned specific objectives for any other funding program, it cannot be the same objective. So this is called double dipping, and the government will not fund for the same objective through two different programs. So it should be very clear what you are achieving in this.
Okay.
So if you've got a debt for, say, human resources, then your pitch here should be probably on looking at an investment for technology, tech dev. Okay, so those are the nuances. Yeah.
Right. Thank you.
Thank you. Apurva, can you just walk us through the questions in the chat box?
Yes, I'll quickly go through the Excel and read some of the questions.
Sure. Thank you.
If I can answer immediately, I will. Otherwise, I'll refer to the speakers here.
Sure.
So Dheeraj has asked, if I'm a co-founder of the other startup, can I still get support from BIRAC? So there is one condition of eligibility, that if you are promoter in another company, which is again ineligible, means working in the biotech domain or more than 5 years old, then you might not be eligible. Plus, if you hold more than 20% share in any of the ineligible company, then you might not be eligible for BIG. I hope I'm clear for this. The next question is, will BIG fund therapeutic startup where after 18 months there is no final product, but instead completion of a phase? For example, in a vaccine candidate startup, there will not be having any marketable product, but there is certainly will be a technology or a patent which can be licensed to any other big pharma. So the answer is yes, you can definitely apply, and you can frame an objective for the 18 months, what you will be achieving in those 18 months for BIG. And that could be any phase having substantial data and results.
And just to add a line, So at the end of the BAG, they don't expect you to have a product with a 50 lakh rupees. It is not possible. Sometimes the regulatory CE certification, they are so expensive. So what they want is whether you have completed those objectives, whether you are ready for the next level. So they may be able to even recommend for further funding, but they don't expect a market ready product in the end of 18 months with 50 lakh rupees. So they also understand. In some case of medical device, maybe it is possible, but in case of certain biotechnology and the drug device and regenerative medicine, it is not at all possible. So only achieving a certain objective and showing those things for the next level of funding is sufficient.
Next question we have, which stage of the startup should I be in, and I'm working on my incorporation? So if you have any idea and you have some proof and evidence and backing up with the publication, you can apply for BIG. And you might incorporate the company while you are in process of, like say, have filled the form also. Till the selection process, you can incorporate the company. That is fine. Next question is how to get fund positively and time required. I think the whole session was answer to this question. I hope you got your answer from this. The other question is, what is the potential lead time to get institutional ethical committee registered and get approved from National Apex Committee for Stem Cell Research and Therapy? So I would request if Dr. Amboj Vishu or anybody can take this question. I didn't think it was.
So this is the Institute Ethical Committee is through the institute where they're applying. So if they're associated or they have their own, they will receive the form from the regulatory agency. It will be processed from there. So we won't be able to help in this particular case. So if they're an academic partner, their institute, if they're a startup, if they have their own ethical committee, so it will be processed through that. Maybe it is better to write an email either to Medivalley or to us explaining where they are, what they are doing, and from there we can help. There is no general answer for this.
Yeah, usually the time frame would be 3 months to 6 months, depending upon the ethics committee they constitute. However, as Dr. Vishu suggested, you may please write to us. Categorically, we would provide our response. Thank you.
Next question is, we would like to apply for a new product development. How do we get partnership with big partner? So you may write to team BIG at IKP Knowledge Park, or may write to even Dr. Sushila or team for BioValley. They will connect with us and we can help in the proposal writing as well. Would like to know more about the selection criteria that the session has covered already. Next question is, can I take PCC reactor project in AMTZ? I think that is for BioValley to answer.
Yes, yes. You may please connect to us. Ankita, just in the chat box, text the info email ID or my email ID so that they can share their information and query with us.
Sure, ma'am. Okay. Next question is, can we use AYT developed ECG monitor and proceed further? Is frequency therapy device allowed to be developed? Any medical device would be eligible to apply for BIG. Okay, I think we are done with the questions. Mostly were on the selection criteria based queries, which we have answered to the sessions. So yes, we can wrap the session if nobody has any.
Any queries from the partners? You generally come up with so many questions. And now I see everybody is so silent. Probably the webinar covered everything. Dr. Vishu, Mr. Suresh, and Dr. Amboj Chaturvedi. I'm full in name now. Thank you so much. I think they're all awestruck because probably every query has been resolved while you spoke itself. However,
I want to pitch in here, some valuable information because it came to ethics committee thing. Recently, I came to know, see, some people may not have a hospital associated with already, or they may not have their, they may not be able to constitute an IEC. That's not very easy. So there are third parties. That's what I heard, though I have never availed any services or anything, but there are third parties who have a really concrete IEC and they facilitate startups. So I think this is really good. Maybe you can search online, but I wanted to bring this to your notice because not everybody has access to IEC, on a day-to-day basis. So you can explore this option. They may charge around 20,000, 30,000 or something for that sitting, but they constitute all, and they should be registered, and they are registered with the, with the regulatory body, and so that is also possible. Just wanted to tell this because it popped up. Yeah.
Yes, Mr. Suresh, there are independent ethics committees associated with big multi-specialty or super specialty hospitals, and AMTZ ecosystem also have one institutional ethics committee, which is into stem cell research also.
Great.
So yes, within 50-kilometer radius in that city, the startups can reach to any hospital.
Yeah.
Or any ecosystem-based IEC to get their research proposals reviewed.
Yes, it is also possible.
Just to add the point. And if the hospital itself has to establish, then it takes 3 months to 6 months time if it is for the hospital setup. But if for a startup, they can always approach a hospital who is having an IEC to review a research proposal, plus adding on it, the hospital may even support for clinical validation as well as one of its partnered site with an MOU, as you have suggested. I see a message, a great session. Thanks AMTZ IKP for covering most of the doubts.
Okay,
Thank
so
you.
I think
That is the reason there are no queries. Dr. Vishu, Dr. Ambuj Chaturvedi, and Mr. Suresh, thank you so much. Really, it was, yeah, it came out from all of your hearts, the way they have to write a proposal. It's a guidance which came from the heart. That is what I could, that is what I could genuinely sense in this webinar.
Good.
So I request all our partners here at MediValley, BioValley, and who joined online to take this opportunity of having IKP as your BIG partner while filing your application form. And they are always there with BioValley and MediValley to support you. So even if it is a small query, a small doubt, you can reach out to us. If we are able to resolve, we would, else not, we would reach out to them for supporting you. Ultimately, we are all looking at the realization of your product and to take it off to the commercial success. So
let me
thank
thank Dr. Visu, Dr. Ambuj, and entire team IKP who is not here, because I must definitely tell that we have really good mentors and advisors and well-wishers at IKP, and Visu and Ambuj being here. I'm just telling from bottom of my heart. So anything that you want, I'm sure there are really good people at IKP who will ensure that your journey goes ahead with no barriers. So I wish to thank IKP, because whatever Statoon has, the way it has traveled last 3.5 years to 4 years with IKPs, otherwise we would not have had our product in the market today. So I wish to thank. So I am also ensuring other people here will also make, benefit from this opportunity and the kind of people we have at IKP. Thank you, sir. Thank you, Ambuj, sir.
Yes, I really second that. I hardly have few interactions with Dr. Vishu and the team. But yes, they work from the heart, and I really suggest our partners to take this association to their advantage, this association to move their project to a commercial success. Thank you, Dr. Vishu.
And just to mention, so we have 172 BIG teams. So if we can't reach you immediately, we will try to connect somebody who is in your same apartment complex also. We may be able to connect. So just ask us.
Yeah.
The apartment, I'm not sure, but city we will certainly try.
Thank you. Thank you, Dr. Ambuj and Apurva.
Have a nice day, everyone. Thank you, ma'am.
Thank you. We can sign it off. Thank you.
yeah, thank you.